Hi, my name is Dr. Sonali Majmudar. I'm a board-certified allergist in solo private practice in the suburbs of Chicago. In my clinical experience, patients who suffer from CSU stay on antihistamines longer than expected. Some patients will stay on it for over a year before escalation of treatment is even seriously considered. Patients who suffer from CSU are used to taking antihistamines on a daily basis. When they do notice some temporary relief, they continue that current treatment management. CSU is highly underestimated. These patients come in looking for treatment, giving patients a hope that you do not have to live like this, and then delivering a treatment management option is what I would like to help my patients with. When we were first treating patients with CSU, we would only start with antihistamines, then advance to higher doses of antihistamines, and then start talking about biologics. Now, with RHAPSIDO, we are able to discuss oral treatment. When these patients come back for a follow-up, they are happy with their treatment. They have less hives, they are less itchy, and now we are able to focus more on long-term management as opposed to discussing short-term treatment goals. Recently, I had a patient in my clinic. She's a 42-year-old female who presents with a 9-month history of chronic spontaneous urticaria. She had been on high doses of antihistamines. She had required multiple steroid bursts for her disease control. And in spite of all these treatments, she was still having daily hives. I would consider RHAPSIDO as a treatment for her chronic spontaneous urticaria. I would consider RHAPSIDO in patients who have already been treated with high-dose antihistamines and are looking for rapid onset of disease control.
Indication: RHAPSIDO, remibrutinib, is indicated for the treatment of chronic spontaneous urticaria, CSU, in adult patients who remain symptomatic despite H1 antihistamine treatment. Limitations of use: RHAPSIDO is not indicated for other forms of urticaria. Important safety information: warnings and precautions. Risk of bleeding: mucocutaneous-related bleeding occurred in 9% of patients who received RHAPSIDO. Interrupt treatment with RHAPSIDO if bleeding is observed, and resume if the benefit is expected to outweigh the risk. Interrupt treatment with RHAPSIDO for 3 to 7 days pre- and post-surgery or invasive procedures. Use of antithrombotic agents concomitantly with RHAPSIDO may further increase the risk of bleeding. Consider the benefits and risks of antithrombotic agents when used with RHAPSIDO. Monitor for signs and symptoms of bleeding. The use of live and live-attenuated vaccines should be avoided in patients receiving RHAPSIDO. Adverse reactions. The most common adverse reactions, incidence greater than or equal to 3%, were nasopharyngitis, bleeding, headache, nausea, and abdominal pain. Drug interactions. Remibrutinib is a CYP3A4 substrate and a P-glycoprotein (PGP) inhibitor. Avoid use of RHAPSIDO with strong or moderate CYP3A4 inhibitors. Concomitant use with a strong or moderate CYP3A4 inhibitor increases remibrutinib exposure, which may increase the risk of RHAPSIDO adverse reactions. Avoid use of RHAPSIDO with strong or moderate CYP3A4 inducers. Concomitant use with a strong or moderate CYP3A4 inducer decreases remibrutinib exposure, which may decrease the efficacy of RHAPSIDO. Monitor more frequently for adverse reactions when using RHAPSIDO with PGP substrates where minimal concentration changes may lead to serious adverse reactions, for example, digoxin. Remibrutinib increases exposure of PGP substrates, which may increase the risk of adverse reactions related to PGP substrates. No data are available on concomitant use of RHAPSIDO with anticoagulants. The concomitant use of RHAPSIDO and anticoagulants was not allowed in clinical studies. Use of the antiplatelet agents acetylsalicylic acid at doses up to 100 mg daily or clopidogrel up to 75 mg daily was allowed in the RHAPSIDO clinical studies. Use in specific populations. There is a pregnancy exposure registry that monitors pregnancy outcomes in women exposed to RHAPSIDO during pregnancy. Avoid use of RHAPSIDO in patients with mild, moderate, or severe hepatic impairment, Child-Pugh class A, B, and C. RHAPSIDO exposure is increased in these patients relative to patients with normal hepatic function.